New cases of coronavirus continue to pop up in dozens of states, including California, Florida, and Arizona. There are now nearly 4 million confirmed cases of COVID-19 in the US, and states like New York are bracing for a second wave. Here to discuss the spread of the virus and much more is Dr. Stephen Corwin. He is president and CEO of New York Presbyterian Hospital Group. Doctor, thanks so much for being with us. I'd love to get your take sort of on the pulse of what's happening on the ground in New York right now. Are you starting to see an uptick in new coronavirus cases?
We have not. We are less than 5% of our peak, and in particular, our ICU cases are about 3% of prior peak, which is quite good. The one disturbing trend that we see in our hospital system is in the borough of Queens, we've seen an uptick in the positivity rate. So in our other boroughs, we're at the 1% positivity rate on testing. We're in the 3 to 4% rate in Queens, and that gives us some pause. As you know, once you get about 5% positivity in testing, you're starting to be dangerously close to getting to community spread. So we've not seen a second wave yet. We're hoping not to, but right now we're in pretty good shape, to be honest with you. Thank you.
Doctor, just based on what you just said and the data you're seeing and what you're seeing in the hospitals, do you think it's time just to open up the New York economy even more? That, yes, we could handle it more than we perhaps could have?
Well, I think what you're seeing is opening is a relative term. The more you open, in the absence of a vaccine, the more you open, the more infections you're going to get. The question is, how do you titrate the two? I think you've seen with things like bars and indoor dining in restaurants that that's a problem. So I think that the governor has done an excellent job in making sure that we're not too quick to reopen. As we've seen in the rest of the country, that quickness of reopening, the absence of social distancing and masking, you can clearly get to a level of community spread that it becomes very difficult to do things like what we want to do. You had mentioned in your earlier segment the Republicans talking about giving money to schools. You can't open schools if you have a pandemic raging. So the things that are really important to us, I think we have to concentrate on keeping the positivity rate well below the 5% range and opening up bars, indoor dining in restaurants, theaters. That becomes much more difficult. So no, I don't see Broadway reopening in the fall. I don't see Lincoln Center reopening in the fall. I think you're looking sometime in 21 for a more robust reopening, if you will.
Wow, interesting that you talk about schools. I mean, I've got 3 kids and they're all expecting to go back, at least to some degree in the fall. Their schools are talking about sort of a hybrid situation where they go in a few days and they're off a few days. Do you agree with that? Or are you basically saying these schools should be closed in the fall?
I mean, well, I do agree with the hybrid approach. I think that it's very important for a number of reasons for kids to go back to school. I think that the online learning is not as robust as in-person learning. There are many kids, certainly in New York, that rely on schools for food security. And of course, parents rely on their kids being able to go to school. So there are overriding reasons why you want kids to go to school. But if you've got a situation like what you have in either Houston or Miami, unfortunately at this point, it's difficult for me to contemplate how you could do that and keep everybody safe because the degree of community spread is so large. And we still don't know enough about kids being a reservoir for infection. We know that asymptomatic spread occurs. So what I would say is we'd love to reopen, but the community infection rate has to be low. And that's what we've seen in Europe, and that's what we have to strive for in the US in order to safely reopen these schools.
Doctor, what's the financial state of your hospital network right now? And then do you think it's time for the government to provide some form of stimulus package for hospitals, not just yours, but more broadly across the United States?
I do. I think it's really important. I know that HCA came out with earnings yesterday that were surprisingly robust. I can tell you from my hospital system, we're about $9 billion in top line revenue. We expect a loss of, depending on a second surge, of anywhere from $600 million to $1 billion this year. This was on top of a historic margins in the 3 to 4% range. So this is a huge blow for us. I think what would be important in the HEROES Act would be to convert the Medicare advance payments to grants. That benefits hospitals around the country. And of course, you're seeing a lot of hospitals really struggle. So I would be in favor of more stimulus going to the hospitals, especially because what we're seeing in the smaller hospitals, rural hospitals, the safety net hospitals in the inner cities, they're not going to be able to make it if they don't get some additional monies.
Doctor, with a loss like that, are you going to be forced to tighten your belt? And what might cost-cutting measures look like at New York Presbyterian?
We're going to take cost out on the expense side. I will say that we made no layoffs a priority, and for three reasons. First, we asked people to run through walls for us. We asked our employees to do the impossible. They did that. You all know how difficult the pandemic was in New York. I can't see turning around and saying to people, we're going to lay you off. We will look at very tight position control. We've instituted a voluntary retirement program. So we're mindful of the fact that the cost structure is going to have to go down. And certainly there are many things on the expense and efficiency side that we can accomplish. So we're looking at about a $500 million expense reduction, but without having to resort to layoffs.
Are you seeing elective surgeries coming back? Because we know that had stopped there for a while. Is that part of your business coming back?
It is. I think that the key to that is what we talked about earlier. We're at about 90% of where we were. That 10% makes a big difference. That being said, I think that people have to feel that it's safe to come to the institution. So everything that we're doing around mask wearing, protecting our patients, distancing, making sure our waiting areas are not crowded, making sure that we do full electronic registration, making sure that everyone can get tested in terms of not only COVID testing, but their full diagnostic testing in one shot so they don't have to keep coming back. Those are very important things. The other important thing is the level of community infection needs to be low so people will have confidence. I think we made a mistake early on, collectively, that it was either you open the economy or you suppress the virus. You couldn't do both simultaneously. We now know you have to do both simultaneously.
Doctor, before we let you go, what's the PPE situation like at your hospital? Are your doctors and nurses equipped and ready for another wave?
We're in pretty good shape. I think that we have accumulated PPE, but remember, the supply chain is still fragile. U.S. manufacturing is starting to ramp up, but is not fully ramped up. Ventilator manufacturing is starting to ramp up. It's not fully ramped up. And as we spread across the country, then the PPE situation becomes more critical. So we are worried about PPE access if the level of infections continues the way that they are. Right now we're okay, but we really want to see much more in the way of domestic manufacturing and a much more resilient U.S. manufacturing supply chain.
Dr. Stephen Corwin, thanks so much for your insights and best of luck to all of you. Thanks for the work that you're doing.
Thank you so much.